I think EI has just set up a really special experience for any fellow coming in to this program. When I met my cohort in April 2024, I think it's hard to describe to somebody who's not been through this process what it feels like to meet a group of people who are mostly strangers and have that feeling like you've kind of known these people like all your life somehow. That's really like a strong feeling of home and family.
To me, health connects every aspect of human life: physical, emotional, social, and spiritual. So when I talk about health equity, I don't see it as just one particular health sector issue, but it's more as a lens. It's the way we see the world, the way we understand how systems, structures, and relationships actually shaped how we live our life and the ability to live well. The EI community, especially in my cohort, I feel like I am part of the family, a big family, right? It broadened my sense of belonging because within this community, I felt that I belong to the group.
That's why when I go back here in the Philippines, I said, no, we are not alone. There are somewhere there who is willing to listen to us, who is willing to help us. A matter of we should communicate our concern.
The learning events that happened throughout the year, they were very important for my leadership development, especially when I learned about how we can shift the systems, through, for example, public narratives, or how I can get people to connect to the core problems in my own work. That kind of learning experience that I actually adapt to my work. And also, I think the EI experience really enabled me to make sure that I don't have all the answers in my work. In the past, when I tried to, for example, develop a policy, I tried to make sure that everyone would be happy with the policy. But from my induction year with the other fellows, I recognized that this is not my solution. It should be the people's solutions. And for me, it's very important that we ask what they need instead of just telling them what they should need. And this is a good lesson for me as a leader and as a person who is trying to make our society better.
In my program, I have a chance to learn from Bangladesh. I learned a very important theory like if I want to handle some community issue, I have to use the community capability, community resource. For a long time, I just try to support healthcare provider, healthcare organization to improve the quality and patient safety. I forget the customer, the patient, the community. So at that moment, something happened. I started the new project. It's called Wise Patient Project. And with my team, we developed, we wrote down a book. It's called the Wise Patient Book to educate for the community, for the patients, know how to choose the good healthcare service and how to work with the healthcare provider to get the best, the safe healthcare service. We were very successful with these ideas because until now we already published around 20,000 copies And we already get the resource from the community, like from AIA insurance company.
The way that we worked together as a community or as a collective action, one of the things that we did was the second year project that we did with young people who live at the border of Thailand and Myanmar areas. So we tried to brainstorm and we tried to find out what it needs to make that children's life easier, especially when it comes to a sense of their sexuality, their gender identity, and their sexual education.
When EI opened the Community Building Fund, it's an opportunity for me as a EI cohort and one of the senior fellows to apply. So the first project I have is the Community of Practice on mental health. We work with the Ministry of Health in BARM to develop some reading materials. We are now influencing the government side of our work. We have the chance to influence also the budgeting of these local government units because it's become a law. The Ministry of Health itself created their mental health unit since they realized how important mental health is. That's one of the output of that project.
So I'm part of the EI Mental Health Equity Working Group. And I guess we do a range, or at least currently we're working on a range of different things. The first one is on more like organizational sort of level. But then we are also trying to look at regionally, what are the gaps that exist and who is being left out of the conversation.
Actually, it's a good thing that the EI formed these thematic groups. And one of the thematic groups is the Climate Justice Warriors. So it's really very catchy. So I would like to see the team who's making or in the front line in addressing climate concern and issues. Right now, we're just still a team and still forming ourselves. There's sharing of experiences and we are learning from each other. And if in case there's available resources, they are teaching us how to access it. So it's very critical in this space because I didn't feel alone.
After I joined EI program, something opened my eye to the world. I mean, my perspective up to the international level. And every year, we will have the new fellows from a lot of countries, and we will cooperate together to make something very huge. I talk with Vietnamese EI fellows, and this term, I'm doing a lot of things with some EI fellows.
So recently, I'm reading a biography, official in China. His name is Chen Yun. He used to be the #2 person in China. He is a very inclusive leader. He said that there is a cup. When you see from the top, you only see a circle. On the left, you can see the shape of the cup. Coming from down, you only see a black hole. So everyone putting their view together, you see the whole cup. I think the collectiveness of this EI program is it helps everyone to contribute their viewpoint on health equity. And when you bring together those people, you see the whole cup. And that's something I think EI is making a difference. You bring people from different culture, different country, different health sector to portray the whole picture of health equity. Then when you know the whole cup, you know how to make a better cup, make a better tea.
In the next 10 years, I would like to be able to see more persons with lived experience being leaders or being invited to the table where important conversations are being had. There is so much that we can do in community, even in spaces where formal systems or formal policies or formal programs like don't exist or fail us. Community has so much power.
In 10 years, I want to see EIs working with senior fellows to help us to work in a very collective way, bringing in partners in our local context and creating this platform to reimagine, how we can work together to make our society better and healthier and fairer.
I want to envision two things of the EI in the next 10 years. The first thing is that I want to see EI fellows to become a pool of innovators, change makers in health equity. They are leading the dialogue, leading the change. The second thing, I want to see the EI fellows, they are the bridges of difference in this region. I think health equity related a lot of social determinant, the economic difference, social difference, but the EI fellows can connect the difference.
For me, EI in next 10 years will be known by a lot of people and community, and our value, our influence will be recognized by community, will be recognized by a lot of good people.
If I want to describe EI in one word, I would say it is caring. It's about caring each fellows. It's about caring the details. The details always helps we become a better person.
The way I describe EI community is collaboration. Because in any time that we need some assistance from colleagues from other EI cohort, they are very responsive of our requests.
If I describe EI in the one word, this would be amazing. I never change my answer because it's my first feeling and my forever feeling.
If I had to describe the EI community in one word, it would be special.
I'm Noraida Abdullah Karim, Director for Mindanao Program of CFSI.
My name is Haibin Zhou. I work with companies, people with disabilities to build inclusive working places.
My name is Lin. I'm a doctor, a pediatric surgeon.
My name is Adison Chantrasu, the Dean at Thammasat University, the Faculty of Learning Science and Education.
My name is Eleanor. I work as a psychotherapist specializing in addiction and trauma.